Hello, my name is Zachary Abbott, and this is my Module 3 Gender Responsive Strategies. So, what is gender responsiveness? It's not a new topic. If you ask most people, boys and girls act very differently, and this is seen and carries over in the juvenile justice system. Boys often offend and do offend at higher rates. Girls only make up to about a quarter of the juvenile arrests. There's differences in the crimes that juvenile girls commit. Girls are more likely to have a history of maltreatment, trauma, running away, and family conflicts. And it is also noted that there are differences in the way that the female brain develops and in relation to younger boys' mental development. So it really does make a very severe difference in the crimes that a boy and a girl may commit as a juvenile. But I came up with this is what I think gender responsiveness is, in my opinion. Their programs and intervention strategies aim to intervene to combat risk factors specific to genders. So it's strategies that are specific to girls and programs and intervention strategies specific to boys. They address specific needs that each gender may have. A risk factor for female youth is dating male partners significantly older than they are. The males are often have a criminal history, and the females can be influenced at a younger age. This program might offer counseling geared towards providing healthy sex education and relationship topics for young females, so we can see the specific program and its goals specific to females. So when we talk about gender responsiveness, strategy number 1, I found a program, Learning / Feminist Intervention. It's a 12-week kind of like course. They're 1.5-hour programs for females. They involve group sessions where multiple female adolescents come together and they develop social skills. You'll see as we go through this presentation, I've highlighted in yellow the specific, risk factors or concepts when we talk about gender responsiveness. Secondly, females with exposure specifically to violence and abuse. We know that from the previous slide that female juveniles often experience violence and abuse at higher rates than boys do. And it also teaches female juveniles power and its role in relationships as far as societal influences. It helps reduce that victimization in teen dating and is shown to be promising. And it also noted that staff are graduate levels and have specific training as far as dealing with younger females. Secondly, I'm going to talk about SNAP Girls. It's an intervention program for young females with disruptive behaviors and their families. It focuses on self-control and emotional regulation. So we see right here, this program is specific to disruptive behaviors. It's 13 weeks long, and it involves ages 6 through 11, and it really helps them at the end of this program, help them make better behavioral choices. And we can see it focuses on 5 core treatment theories: systems, social interactional learning, cognitive behavior foundation, emphasizing on emotion and social information processing, and skills difficulties in children. Lastly, number 3 responsiveness strategy is a culture focused program specific to Spanish-speaking Mexican Americans. So this program is specific when we talk about young female offenders, because it talks about substance abuse and gang violence. Girls are recruited by social workers and referrals. It teaches meditation and conflict resolution, but really shows them, it, it gives them self-esteem and a social background to kind of help them learn better social habits. And this one is 9 months long, 2 hours a week. But it also, we see here towards the bottom, that it also helps focus on educational needs as well. All right, when we talk about Callie's situation, highlighted in yellow is the risk factors that I see in her life. We're going to talk about substance abuse. She has on multiple occasions used substances with her father. She also has past trauma. She was assaulted. This wasn't specifically beyond just the word assaulted in the document, but a program that could help address that would be very helpful. Lastly, she does have some behavioral issues with her sister specifically. It often erupts into physical altercations. So I think strategies would be to address her substance use, to address her past trauma as far as physical and sexual assaults, and focus on the behavioral issues within her family. So we could use pretty much any of the 3 programs that I listed above to kind of help address each one of those risk factors in her life. And I just want to kind of highlight there's still hope for her by addressing these risk factors in her life. We can kind of help her rehabilitate and kind of avoid an incarceration situation as an adult. And these are just the resources I used. Thank you.